Thank you, Shah. Extend a warm welcome to everyone who is joining us in this webinar. Today, our speaker is Dr. Kaloyan Kamenov. He's a technical officer at the Disability Program at the World Health Organization headquarters in Geneva. And we have Dr. Mohammad Ameel, a technical officer for assistive technology from the WHO Regional Office for Southeast Asia, as one of also as a reactor. And then I think this topic, without much explanation, I think everyone understands the importance of the topic about accessibility of telehealth services. But just to get started, and then while a few others are also joining, maybe I can give a quick 1-minute introduction of why this is relevant. I think there is no doubt that telehealth holds immense promise for extending access to healthcare, particularly for underserved populations. However, its true potential can only be realized if the services are truly accessible. Accessibility isn't just about having the technology, it's about ensuring that everyone, regardless of their physical abilities, digital literacy, language proficiency, or socioeconomic status, can effectively use telehealth services. Without a focus on inclusive design and equitable implementation, I think we are risking exacerbating the existing health disparities rather than bridging them. Therefore, it is important and relevant. The accessibility of telehealth is not just taken as an ethical imperative, but also a fundamental requirement for building an equitable and effective healthcare system. I would like to now hand over the floor to our speaker, Dr. Kalayan. Thank you. Over to you, Dr. Kalayan.
Thank you very much, Jai. And thank you, first of all, for inviting me to present today. And also, thank you for the opportunity to given me to talk a little bit about some of the tools that WHO, together with the International Telecommunication Union, has developed and published in the last couple of years. It's a real honor to be here, and I just want to apologize in advance. My voice normally is not that strange, but I have been sick for some days, so apologies. I will try to speak very slowly and a little bit louder, but let me know if you have any difficulties understanding what I'm saying. Now, Jai already introduced the importance of this topic, and he already hinted to some of the reasons why WHO and ITU started work on this topic. Now, on the one hand, I can say that there are two aspects that really drove this agenda for us and for ITU and led to the development of these tools. One is sort of the global picture and the evidence that we started receiving a lot, especially during the beginning of the COVID-19 pandemic, where we saw, on the one hand, the expansion of telehealth services at a global level. Almost every country in the world started using, in one way or another, telehealth services locally or regional level or at national level. And of course, we can say that this contributed to a more equitable delivery of healthcare to people in countries, those that live in rural areas or more remote areas, those that, for example, do not have the capacity to go physically to a health facility and receive healthcare. So we saw, on the one hand, this expansion and the great opportunities that telehealth brings to the population. But at the same time, we also saw a lot of barriers that certain population groups experience when they try to access and use these services. Now, because I work for the WHO disability team, of course, a key focus of our work, and as you will see when I present the tools, a key focus of the content of the tools is our persons with disabilities. And there is a very good reason for that. It's the largest minority in the world. Now we talk about 1.3 billion people, or 1 in 6 people in the world who have disability. But of course, accessibility is not just for persons with disabilities. It's also for other marginalized populations that may experience very similar barriers. Older adults or people who have low literacy levels in terms of digital and also health literacy, migrants and refugees. So we have a lot of different marginalized groups that experience different barriers when accessing and using telehealth services. So on the one hand, we have telehealth services that are supposed to bring more um, equitable healthcare. On the other hand, we have millions of people who cannot benefit from these services. And in the lack of uh, global standards for accessibility of telehealth services, WHO and ITU stepped in, to develop such global standard. And I have to say that, of course, there are existing international guidelines. There are several countries that have already developed their own standards or legislation or policies on accessibility of digital health or telehealth services. But when we started developing this document, it was really about creating a global standard that can really regulate a sector and that can be adopted and applied by manufacturers around the world, that is comprehensive enough to really address all the different barriers that persons with disabilities and other population groups experience. So we have at WHO the health mandate, and also to ensure that persons with disabilities have equal and equitable access to services. ITU, of course, has the mandate given by member states on accessibility to information and communication technologies, making sure that we live in a world where we achieve equitable communication for everyone. So we joined forces and we developed, first of all, a global standard on accessibility of telehealth services. Now, I put this slide just because I wanted to emphasize that for us it was very important when we develop these documents to make sure that we have followed a very comprehensive and very inclusive approach, in the sense that we developed the standard for about 2 years, and we consulted with a large number of civil society organizations and organizations that represent persons with disabilities or older adults, just to make sure that we have their voice and their priorities and more information on the barriers that they experience. We also did workshops with the industry, telehealth developers, just to make sure that what we propose is feasible and can be easily implemented. So in 2022, we published this WHO global standard for accessibility of telehealth services, and it really targets three main groups: the governments, the health service providers, and also the manufacturers of telehealth platforms, because ultimately these are the authorities really that can ensure that the provision of telehealth services is made accessible. The standard itself provides a list of 25 technical requirements that telehealth platforms must have in order to ensure accessible telehealth service provision. Now, the way we structured the document, it was really around the different types of groups of people and the different types of barriers that they experience. And what I mean by that is that we divided the content of the standard around groups of people, like people with vision impairment and blindness, and what the recommended technical requirements really are, to make sure that this group of people can use and access telehealth services. We have a chapter on people who are hard of hearing or deaf, people with speech and language difficulties, people with mobility impairments, people with mental health conditions. developmental and intellectual disabilities or with learning disabilities. And the way we really developed this standard was to use the different barriers as a starting point, and then based on that to create the recommended action that needs to be integrated in the telehealth platforms. We also have a section which provides some requirements for the planning phase. So for example, if someone is calling or is making an appointment to see a doctor through the telehealth platform, what are some of the considerations that need to be taken to ensure that this process is accessible as well? I will give you just a snapshot, a couple of examples of what some of these requirements may look like. And of course, this is just a summary in the actual document, which we will put also in the chat, the link to the documents. You can see a much larger and expanded description, explanation of what this means, how this can be done, etc. So, for example, for people with vision impairment, it is important that the telehealth platforms are compatible with assistive devices, like, for example, screen readers or braille keyboards, the color contrast and screen magnification, which are options that are very important for people with certain degrees of vision impairment, should also be available as features on the platform. You know, sometimes videos that are included, if the telehealth platform is more sophisticated, should not include background music. It may be confusing for people with vision impairment. Then ambiguous wording and inaccurate descriptions in videos should also be avoided. And where possible, services using telephone calls should be also available in case the platform itself is not 100% accessible. If we take an example with people with developmental and intellectual disabilities, of course, it's really more about understanding how to operate and how to use the platform. So any key documents or any information that is provided on the telehealth platform, or by the doctors, if they send some files, it really needs to be in a more simple, easy read format, so it can be understood by people with intellectual disabilities. Also, very often people with intellectual disabilities may need their support person to help them throughout the process. So the telehealth platform should allow for more than 2 people to participate in a meeting. And then, some a simple educational material on how to use the telehealth service should be made available on the platform, like a little tutorial, but explained in an easy way. So as you can see, of course, some of these recommended features may require a little bit more of, let's say, technological time and resources to be integrated. Some others are, I would say, very easy. They don't require a lot of resources or time or knowledge on how to do them. And one thing that's also important to mention is that we all know of the web accessibility guidelines, and there is a certain overlap between some of the recommendations that we have included in our standard and web accessibility guidelines. Some of our also recommendations point to the web accessibility standards in guidelines, when just to understand a little bit more about this specific recommendation, or if there is an explanation of how to do it and how it can be applied. So there is a certain overlap. There are, of course, things that we include in our standard that are not included in the guidelines. So there is definitely, I would say, a little bit more, especially for certain population groups, like people with learning disabilities, or with intellectual disabilities, or mental health conditions that may not be a key focus of the web accessibility guidelines. Now, we published this standard in 2022 in the summer, so about 2.5 years ago. And in the next months after we published it, we received a lot of demands, especially from civil society, but also from some member states, on the need of developing a more practical step-by-step guidance on how this standard, global standard, can be adopted and implemented. And this led us to the development of this implementation toolkit for accessible telehealth services, which we published just about 4 or 5 months ago. The purpose of this toolkit is really to provide some practical guidance and facilitate stakeholders in the adoption of and the implementation, also monitoring of the global standard. And here we target the same three groups: the governments, the industry, and the health service providers. But also we have a section on civil society, because we think that civil society can play a very big role into really advocating for the implementation of this toolkit, of this standard to be published, to be implemented and adopted. Now, the actual implementation toolkit is divided into 4 sections around these 4 target groups, which are structured in a very similar way. We provide some guidance on what are some of the actions that the governments can take, and other stakeholders can take. So I will give an example just with the governments, because we don't have time to go through 4 of them. But the other 3 groups, the industry, the health service providers, and civil society, they follow a very, very similar format. So, for example, if we take governments here as an example, what they can do is, of course, they can either integrate the recommendations of the standard in existing legislation, or policies or regulations, or they could develop a new one on accessibility of telehealth services. Some countries have legislation around which is a bit broader around digital health. So this can also be a good way to integrate some accessibility recommendations there, specifically targeting telehealth platforms. Another action could be, of course, to have mechanisms for enforcement through government regulations and policies. So making sure that it's not just the adoption of the legislation, let's say, but also that there is an enforcement in the implementation of these recommendations, making sure that the platforms are accessible. There are actions around the procurement policies. Very often, especially some government agencies, they may be procuring telehealth services platforms, and so making sure that they also know about this, and that it is integrated and implemented and adopted. And then, of course, another action can be simply a public awareness campaign, just ensuring that the public knows about the importance of this issue and the fact that millions of people cannot benefit on an equal basis using telehealth services. We then provide some guidance around potential partners that can be engaged in the process. So, of course, it will depend in every country who may be leading on this, whether it will be Ministry of Health, Ministry of Telecommunication, but certainly different governmental departments can be involved: manufacturers, service providers, civil society, of course. It is very important, and this is one of the things that we emphasize throughout the whole document, that is very important to have the engagement of user groups. For example, persons with disabilities, from the very beginning, from the design of the platforms throughout the development process, simply because they're the ones that really know what may be the issue, and really suggest that there should be a solution of this issue. Then we go into another section for, so for example, for governments, we really make a step-by-step proposed, present proposed actions and steps that can be taken to make this happen. So for example, for one of the things that governments can do is to start with an assessment and the policy development. So conduct a situation assessment in which they really a deep dive into the existing policies, regulations, legislation, who does what in terms of telehealth and accessibility? Are there already any steps taken? What are some of the gaps that are experienced by the population groups? Just to understand really what is the current situation in the delivery of telehealth services and how accessible it is in the country. And then, of course, to start planning the policy development or the adoption of this standard. It will be very important to organize a planning consultation, just making sure that all these different stakeholders that I mentioned before are at the table. They have their voice being heard there, and also they're an active participants in this endeavor, and that really the whole process is inclusive. And of course, then to adopt the actual standard into existing or developing a new legislation or policy. Then, of course, the next step would be naturally to have a dissemination strategy and the launch. So it is important that there is a dissemination among all the different user groups, that persons with disabilities, for example, and other marginalized populations, they know about the existence of this policy and or legislation, that now they can use the telehealth platforms, they can take advantage of it, etc. That there is also a sensitization workshop with the industry on why is it important also for private manufacturers, for example, to really adopt this into their work. And of course, a media outreach, just making sure that the large public knows about this, and that telehealth now can be expanded. Because of course, I'm giving an example with governments now, and it's the responsibility of the government to ensure that every citizen has an equal access to telehealth services. But even if we look at the manufacturers, of course, it makes a perfect business case, which will expand the clients of the telehealth platforms when more people can access them. And then, of course, the last one is around implementation and monitoring. So to monitor the policy implementation, and then to undertake evaluation and potentially revision if there are some lessons learned and things have not happened in a way that they should have. So this was the second tool that we developed. It was published last year, as I said. And now, just for a couple of minutes, one thing that we worked on with ITU as well, and it will be published on the ITU webpage, I believe very soon. It's just a simple compliance testing or conformance testing document. This is something that ITU normally does with the different standards that they have, just making sure that when manufacturers want to comply with the recommended features in the standards, that they know how to integrate them, and then they get, of course, a conformance, a certificate of conformance with this specific standard. So it is just a screenshot, because it's not yet published officially. But it's basically a very technical document with a checklist that gives really the necessary information and specifications for each of the 25 recommendations that we included in the standard. So, for example, compatibility with assistive devices. So this was a recommended feature. Color contrast and screen magnification was a mandatory feature. And we provide some short information on the methodology for testing, for example, for the compatibility, to to verify, just to run a test with a screen reader to check whether the text on the platform is accessible, then run a test with the Braille keyboard to see whether the text can be read. And then we have some further comments just to explain, for example, why this feature is recommended, or why it is really needed to see and to comply with this specific feature. So this one, as I said, will be, I believe, published very soon, but it is really targeting only the manufacturers, because this is just a way for them to make sure that they comply fully with the recommendations. So I know that probably I spoke a little bit more than I had to, so I will stop here. And of course, I'm interested to hear from the reactors, and also at the end, if there are any questions, happy to respond. So back to you, Jai. Thank you.
Thank you, Kalayan. This was very, very helpful. I think having a standard is one thing, and then getting the manufacturers who are having the solutions or devices in the market conforming to those standards is another thing too. And then taking that as an important means of putting the standards to practice. Dr. Ameel, though I introduced you, maybe a quick word about your work at WHO CRO, and then I will get started with the questions to you.
Thank you, Jay Ganesh, for having me, and thank you everyone for being here. And Kalian, great presentation. Thanks. So about me, I work with the WHO's regional office, the Southeast Asia regional office, which is responsible for 11 countries, a quarter of the world population. We are based in New Delhi, India, and of course we work for South Asia. My primary role is on assistive technologies, but of course I lead the work on disability inclusion, rehabilitation, and I also work on health technologies, which include medical devices, diagnostics, and systems and services around it. So yeah, thank you.
Thank you, Emil, for the introduction. How do you see the application of the standard that which actually Kalayan explained to us uh, in the region, like especially in this region of Southeast Asia, and then what we can do to accelerate the process of taking the standard to practice or adoption and implementation in the countries? Over to you, Emil.
Thank you. See, Jai Ganesh, this is a wonderful question. A lot of time we've seen that we make beautiful standards, beautiful policies, beautiful guidance documents, but unfortunately, they do not translate into actions in the field. And if doesn't happen, I don't think so. A policy should be is any worth. The paper doesn't mean anything. It has to be actually implemented on the field, and that is true for not just these standards that we are talking about. I work on, for example, essential diagnostics list, but excuse me, I beg your pardon. But unless those essential diagnostics lists or essential assistive products list is we make a plan for provisioning, I don't think so it makes any sense. So coming to your question, how do we make sure that these could be translated and could be implemented in the countries? I think it is very important that we start working with the governments and with WHO. We have presence in, at least in our region, we have presence, good presence in all the country. We have good country offices supported by people working on digital health, people working on information systems, people working on disability inclusion, and these teams could actually work with their government counterparts to have these standards incorporated. See, ideally, the best way is that these are incorporated when these telemedicine systems, the telehealth systems are being made. But of course, if the systems are already in place, we could still work around to have these incorporated at a later stage, although not the best way. Because see, these telehealth platforms also keep coming on with their newer versions. So, for example, we are working with Government of India in on the eSanjeevani platform to make sure how these platforms have the disability inclusion incorporated. So we've had some good initial conversations, and some actions need to be translated. That is the most important thing. But honestly, we are very happy to map out and see which and in fact, my digital health platform colleague is very much must be on top of it to see which country is using which telemedicine platforms, which telehealth platforms, and we could definitely work with them to see how this could be translated. Of course, it would be a cross-divisional work where the digital health teams and the disability inclusion teams work together. Yeah, thank you.
Thank you, Amil. That was very helpful. I think we have a lot of veterans here I can see on the call who have been actual practitioners of telehealth. So I take the liberty of pulling few of them for some quick observations and reactions, and then we can probably take more questions. I think, yeah, we have Dr. Prem Nair, who is the National President for Telemedicine Society of India, with us on the call. Dr. Prem Nair, maybe like with your vast experience, of course, you're working with the hospitals as well as like being in the Telemedicine Society of India. Like, can you ask you for your quick feedback and suggestions from your experience? Let's have your quick intervention, please. Thank you. Over to you.
Thank you very much for having me on the program. Congratulations. The concept of integrating telemedicine and telehealth with assistive devices is a very important concept which is initiated by WHO, and I was surprised that the disabled represents about 1.8 billion people, so that it's a very vital component of telehealth services. I would like to thank you again for having me. On behalf of the Telemedicine Society of India and the Amrita Institute of Medical Sciences, I would like to welcome you and thank you. As far as telemedicine goes, as you know, telemedicine services in India being a very early adopter of telemedicine, there are a substantial amount of very exciting work that has been done in telemedicine. This has been ably supported by ISRO right from the very inception. And we basically have been working with the issue of accessibility and the rural-urban divide in India. And this is a very important area. It's been rather slow in the upswing, but over the past few years following COVID, we have seen a tremendous acceptance of telemedicine connectivity and treatment among the general public, which has substantially contributed to the rapid advancement of telemedicine in India. Once again, my sincere thanks to the presenters, and look forward to interacting with you. Thank you.
Thank you, Dr. Nair, for being with us and sharing your views. Maybe I will ask a couple of others, unless otherwise there are some questions. I do see Dr. Alvin Marcelo from the University of Philippines, Manila. I know, Alvin, like you have been involved with the National Telehealth Center in the Philippines. Maybe we can have some quick views from you. And then I also see Dr. Sheila John from Shankar Netralaya, who has been a veteran of teleophthalmology for years. And then we also have Alan from ISO Working Group on 13131 on quality planning standards, where we have also had use cases, and a couple of them were related to assistive, including speech and language pathology and hearing. And then we do have Derek joining us from the WHO headquarters, and we have Gumindu involved with telemedicine in Sri Lanka. I think quite a bit of people who have been involved and actually taking telehealth services to practice. So please feel free to share your views. Maybe have some quick views. We don't have much time, but we certainly have time, at least another 15 minutes, another 10 minutes. Maybe over to Alvin.
Yeah, thank you, Jai. Congratulations to Kaloyan for the presentation. I think the standards are very important. It's good to have these standards available. I think the next step would be implementation and guiding the implementers on how they can adopt the standards and make it work within their working environment. So I appreciate the input and the updates. So I hope that we can have more sessions like this in the future. Thank you.
Thank you, Alvin. I will ask Bijay. Bijay has been a long-standing implementer. I know him for more than, I think it's about 2 decades. Vast implementation experience, right from, I would say, that very beginning of telemedicine implementations in India. Bijay, over to you.
Thank you, Jagnesh, for inviting me to this and giving me an opportunity. And thank you, Kaloyan, for giving such a wonderful presentation. And Kaloyan and Taylor were our speakers in 2022 telemedicon conference. I don't know you remember it. Just after the guidelines were released. I think probably the first conference we were proud to have you as our guest. I was organizing secretary for the conference, and Jagnesh was the person who connected us. And thank you. Then I was also fortunate to do some program in the COVID time. We were able to connect to the physically challenged people who are we are connected in Bangalore. We were giving service that time, and we were physically demonstrated many exercises and all online. And this is a very interesting topic, and we must have some guidelines implemented all across it. Thank you very much. Thank you again.
Thank you, Bijay. Dr. Sheila John, over to you.
Thank you, Jay Ganesh. In Shankar Netralia, we've been implementing mainly we have mobile teleophthalmology vans. We go into the rural villages with paramedical staff and do the examination there, and teleconsultation is done from the camp spot to the base hospital to help these poor people to get specialist care. A comprehensive eye examination is done at the campsite with all the paramedical staff. And then whatever patients require further investigations and treatment, they're brought to the base hospital. That's how we do. We do in eye care, teleophthalmology. We conduct about 20 camps in a month.
Thank you, Dr. Sheila John. Just wanted to know the relevance of accessibility in your, teleophthalmology services. Maybe, yeah.
Most of the areas now, initially when we started in 2010, the access was not so good. It was more of satellite connectivity and less of internet connectivity. But over the years from, I think, 2020, 21, post-COVID, internet connectivity has increased in all the villages. Most of the places we are able to do. The areas where we cannot do, we have an audio call and the patients are brought to the base hospital.
Thank you. Maybe we can have a quick view from Alan Taylor. Alan, over to you.
Hello. Look, it's very interesting work, very interesting presentation, and thank you for that. From where I sit in Australia, this issue is very important, but it hasn't had sufficient attention, and that is in part due to the structure of our health system and the structure of our governments. But it's certainly an area that we could try to work with WHO to encourage an Australian version of this standard, which I think could be incredibly useful. As well as working on standards in Australia, I work with International Standards Organization, and we have a task force called Task Force on Telehealth and Virtual Care. And I put in the chat a link to our report, which on telehealth and virtual care, which proposes several things, including further standardization work, but more importantly, probably in trying to improve international collaboration between very different organizations, and trying not to invent the wheel, trying not to duplicate, and trying to share it as much as possible. So I look forward to working with everyone on those issues and on this particular important issue about access for all to telehealth and virtual care. Thank you.
Thank you, Alan, for sharing. And I think, Gumindu, you would like to share about the work in Sri Lanka and then the
Yes.
relevance of the standard?
Yes, thank you very much for the opportunity to speak, as well as congratulations on the great presentation. On behalf of Sri Lanka, I would like to say we have put the telemedicine guideline in the publication a few months back, last year. And also that we know that guidelines important is that most countries doesn't have a acts or laws legislatively. When compared to other digital applications, this telemedicine is directly involved in clinical practice, which is relevant to med practice, and doctors are very concerned in practicing digital health, and we need those guidelines to get adhere them to practice. So, and there are a lot of applications are coming up, especially after what we call COVID pandemic. We call this as the digital health pandemic also. So it's very important these guidelines are streamlined. And as I'm a specialist in the digital health or health informatics in Sri Lanka, and I'm working at the Health Info Unit, which is the main point on controlling the country's digital health pathway. So it's important that we at the main center streamline and assist the government as well, non-government as well as the private sector in giving best health care for the patient using telemedicine. Thank you.
Thank you, Gumindu. I also see Chris joining us from Jembi. Chris, do you think that I know that you're actually working with regulatory sandbox. So do you think that such standards could also be helpful to go through the sandbox, or and how exactly that approach of regulatory sandbox could possibly help? And I know that you have been working with standards all along. Maybe I can pose this question to you.
Thanks very much for the question. Indeed, we are exactly looking that possibility at the moment within the African context at a number of different solutions for regulatory sandboxes, one of which is telemedicine. And this presentation today and the requirements has been for conformance testing, has in fact been very, very useful for us to consider that. There's a lot of interest in a number of different African countries in regulating for telemedicine for many of the reasons that you've explained today. We are sort of working on a conceptual design for what the sandbox itself could look like. Many of those are sort of process tests. So in other words, in addition to technology tests, also process tests in terms of how the function is actually conducted. So that's pretty much what the two aspects that we are working on, i.e. the conformance testing and the compliance testing. In terms of standards, so my sort of expertise has mostly been on interoperability and content standards, as opposed to the standards for telemedicine. So I'm fairly new to that, but very much looking forward to getting more involved in it. But the other part of the sandbox that we're looking at is really looking at some of the interoperability and content standards, which may apply in this context as well. And also just to say that the other aspect that I could mention is that we are looking very much at the sandbox as both a regulatory sandbox and as a sandbox supporting innovation in the environment. So often the sandboxes, the emphasis has been on the regulatory side and conformance and compliance testing. Our thinking as well has been that it will also support innovation in the space. So in other words, provide functionality to allow entrepreneurs and people even with mature solutions, to use the sandbox both as a sort of almost a playground to develop to develop the solutions as they are building them. So in other words, to include the regulatory elements in the solutions that they are developing, as well as testing it once they have a mature product. Thanks very much.
Thank you. Thank you for being with us and sharing your views. We have less than 5 minutes to conclude. I do see Derek Munene, the unit head for capacity building and collaboration at WHO headquarters. And Derek, like maybe we can have a final view from you, and then over to Kaloyan for wrapping up. Over to you, Derek.
Thank you so much, Dr. J. Ganesh, and thank you so much, Dr. Kaloyan, for the excellent presentation. Good morning, evening, and afternoon, esteemed viewers. I'm Derek Munene, Head of Capacity Building and Collaboration at WHO. We have enjoyed this particular webinar, and also have enjoyed our relationship with our sister unit at WHO, where Dr. Kaloyan comes from, especially on the technical product that he spoke about. We have also enjoyed our partnership with AeHIN, a member of the Global Initiative on Digital Health. To the topic of the day that we've just heard, we are pleased to mention that this is an area of work that WHO is expanding. And so accessibility is just one, but really making telehealth a regular service modality is our grand goal, so we can reach as many people as we can, so as to ensure that UHC is a reality and that we leave no one behind. It's enshrined in the Global Strategy on Digital Health as objective number 4, and we have a working group at WHO that is looking at this area, including a number of external actors and partners. The key is to really ensure that we're reaching as many people as we can with health services through this connected environment, and making sure that we are inclusive and that we include equity in our processes. This accessibility dimension is as important. And so I want to thank AeHIN for convening us, and all the speakers that have spoken for the tremendous appetite. We are celebrating the 20 years of WHO in digital health this year. And at the same time, the Global Strategy on Digital Health has reached its climax. And we hope to continue this conversation moving forward to make the conversations a reality. Thank you so much, and handing over to you, Dr. J. Ganesh.
Thank you, Derek. Thank you. Over to you, Kalayan, for the final words, and then we have a group picture to wrap up.
Thank you, Jai. And I think Dr. Munene also, in a way, wrapped up very well the message, and especially the aim of our work at WHO. So I really appreciated all the reactions, and I can definitely sense that there is an interest, and this is I think the webinar today is a great platform to promote this work. What I heard from almost everyone is that we have standards, but what's more important to have to have them implemented. And I think that right now we have the tools. As Dr. Ameel said, we also can provide the technical support and to governments in the implementation of the standards. So let's just start work and make sure that when we speak about health for all, it's really health for all, including those marginalized populations that I mentioned that currently are excluded from the provision of telehealth services. So thank you again for having me presenting today, and I look forward to collaborating in the near future. Thank you, Jai.
Thank you, Kalayan.
All right. Thanks, everyone.